friends. I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee. And this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So, welcome to the Dr. Molly Says podcast. Hello, people. We are going to do a short episode today, like we did last week, about a specific veterinary medicine topic. I got some great response from our pancreatitis and pancreas and EPI episode last week. I think you all like the quick to the point information about these diseases. So we're going to cover another one today, and that is intervertebral disc disease. So if you've never heard of IVDD, is what we call intervertebral disc disease, I'd say it's one of the more common issues that we see in general practice in veterinary medicine. It can affect a lot of different dog breeds. There are some poster children, which we'll talk about, but it's something we see a lot. I do think it's something that is maybe not talked about on a, GP everyday basis enough. I think sometimes clients are just told their dog has back pain, and their vet maybe just doesn't have the time to really explain to them that they think this could be IVDD, what is making their back hurt. And so I think it's great for you to really understand what that means and what it is. So intervertebral disc disease. So what is IVDD? So before we talk about the disease, let's talk about what anatomy is this having to do with? So in the back of a dog, so the spinal cord runs along from your dog or your cat's neck all the way through to their tail, okay? And that cord is literally what it sounds like, a cord of tissue, and it's protected by a very intricate system, which are the vertebrae and the spine. So the vertebrae surround the spinal cord, protect it, and, create stability of the body. And there are different sections of the vertebrae of the back. So you have the neck, we call that the cervical spine. And then the spine over their chest is called the thoracic spine. And then you have the lumbar spine over their hip area. And so that's what makes up the kind of system of a dog or a cat's back. And there are in between, so there are multiple vertebrae, those individual bones that protect the spinal cord. And in between each pair of vertebrae, there are discs. And so when we talk about intervertebral disc disease, we're talking about an abnormality of the tissue that's in between the vertebrae. Okay, so that's kind of a breakdown in layman's terms of what the name means. So those intervertebral discs basically serve as a cushion between the vertebrae for a bunch of different reasons. One, to help protect the spinal cord, and two, to keep those vertebrae from pushing against each other and touching. So it creates comfort in the back and helps with the entire system of how the back is supposed to work. And within that cushion, there is what we call a nucleus pulposus. And in vet school, we were always taught this is kind of like the jelly inside of a donut. So there's basically layers to this disc. And what happens with intervertebral disc disease is there's some abnormality, and basically that jelly part of the disc can start to bulge, and it can push on the spinal cord. And so and there's inflammation involved, and there's pressure that can cause pain, and inflammation. So when we have intervertebral disc disease, we're going to talk about sort of all the different varying levels of that issue. But basically what's happening is there's some bulging in the disc, the intervertebral discs, and inflammation. And that can cause a range of symptoms. It can cause anything as simple as some mild pain to paralysis. And depending on where that abnormality is happening, whether it's in the neck or the thoracic spine or what we call the thoracolumbar spine, another really common place, the location of that bulging and that inflammation can affect what that patient actually looks like, what their clinical signs are, and what is happening. So there are two types of intervertebral disc disease. This is another important thing to know. We call them Hansen type 1, Hansen type 2. And this is sort of more of like what your doctor will know, but Hansen type 1 intervertebral disc disease is more common in what we call chondrodystrophic dog breeds. And what the heck does chondrodystrophic mean? So basically, chondrodystrophic, what it means abnormal cartilage formation. But dogs that are chondrodystrophic are what you think of dachshunds or basset hounds. So dogs that have shorter, stubby legs and long backs. So there's a disproportionality about their anatomy, and those dogs are what we consider chondrodystrophic. And those dogs are who are more likely to have Hansen type 1 intervertebral disc disease. IVDD is what I'm going to call it from now on. So Hansen type 1 IVDD is more of a sudden acute bulging of some of that disc. And this is what we, like I said, see more often in Frenchies and Dachshunds and other chondrodystrophic breeds. And then there's Hansen type 2, and this is more of a slower, more degenerative problem that just happens more slowly over time. And this is going to be more likely in larger dogs, and we see it more in older dogs. So let's kind of dive back into chondrodystrophic dogs. So that abnormal cartilage development that has to do with these dogs with short, stubby legs, long backs, we think there's a gene involved in this, can lead to early disc degeneration. In some dogs, some of these dogs, it can be as early as 1 year of age. So breeds we think of, like I said, Dachshunds, Frenchies, Corgis, Beagles are actually technically one of them, Pekingese, Cocker Spaniels, Cavaliers. These are all breeds that are more likely to have that Hansen type 1 intervertebral disc disease. When we think about IVDD in veterinary medicine, I did this with the pancreas last week. If I say IVDD, then a room of vets are probably going to think of a dachshund first. They might also think of Frenchies because we're going to talk about it, but Frenchie IVDD is really on the rise. They have a lot of issues with it. But dachshunds are the poster children for IVDD. There are studies that say that up to 20% of dachshunds will have IVDD. That's a lot. That's a fifth of the population of dachshunds. So really common in dachshunds, and we see a range of symptoms in those dogs. And then we also see it in the others that I just mentioned. Frenchies actually are one of the breeds with the highest surgical caseloads. So if you follow any veterinary neurologist on social media, Dr. Cellini comes to mind. He talks sometimes about how, well, he just shows that he's doing surgery, back surgery on Frenchies all the time. So dachshunds may have a higher percentage of developing IVDD within their population. But it seems that Frenchies are needing to have more surgery for this. And it's an important thing for anyone who's thinking about getting a Frenchie, which we're going to do a breed episode about Frenchies. Wait, we did. Oh my gosh, we did do an episode about Frenchies. So this is another important thing to think about. If you're thinking about getting a Frenchie, a lot of people don't realize that IVDD is a common issue, and they do require surgery a lot of the time, and it's very expensive. When we talk about Hansen type 2 dogs, dog breeds that are prone to this, we do think about German Shepherds, Labs. I feel like I've seen a good amount of herding dogs like Border Collies, dogs like that with type 2. Those dogs are also more likely to have those lesions in their neck, which again, like I said, can have some effect on what their symptoms actually look like. So that's who gets IVDD. Any dogs can have IVDD. Cats can technically have IVDD. This is mostly a dog problem. Clinical signs of IVDD. So you as a pet owner, a dog owner, what are we looking for to look like IVDD? And like I said, there's a wide range of symptoms we can see. Sometimes it can be as subtle as some mild back pain. Back pain can sometimes be a little confusing. If you have a dog who's suddenly just crying out randomly, or when you pick them up a certain way, or when they move a certain way, that can be a sign of back pain. Neck pain can also be a little bit tricky. I often talk to dog owners who think their dog has some type of front leg pain, but really what's happening is they're experiencing neck pain, and it can look like they're sort of limping, but I think their pain is radiating right from their neck. And so they move their front legs abnormally to try to compensate for the pain that happens when they move their neck. This is something we'll see when dogs have neck pain, especially. They don't want to put their head down to eat out of a bowl. So that's one sign that they've got some neck pain going on. Something else that's reported a lot by pet owners is that their dog looks like they're hunched over. So they kind of stand in this hunched position because that feels a little bit more comfortable to them. Some of these dogs just literally don't want to move. They're just like, I'm frozen. It hurts to move, so I'm not going to move. They don't want to get up. It's hard to get up. It's hard to lay down. And so usually with IVDD at first, they are just painful. All of these are signs of pain, not eating, lethargy, crying out. Sometimes they can have pretty sharp pain. They hurt. So that's usually how IVDD starts. They're uncomfortable, they're painful, and then this can progress to neurologic problems. And that's because of that pressure that's being put on the spinal cord. So neurologic changes that we'll see, a lot of times that can start with some ataxia. So they'll look a little wobbly. They kind of look like they don't know where their back legs are. They can be falling over, tripping over their legs. Their back legs or front legs can cross or seem very weak, like they're collapsing. They can be dragging a paw, back paw especially, and that's because they don't really know where their feet are. And then eventually, in severe cases or cases that progress, these patients can actually become paralyzed. So they can lose all function of their legs. They can't feel them at all. They can lose bladder and bowel control, and they can become paralyzed in 2 to 4 legs. So obviously, that's a serious situation. Often these dogs will present to us, the veterinarians, with pain. So their owners bring them for signs of pain. And then in an exam, we as a veterinarian, first we have to identify, okay, is this patient painful? I usually start by palpating their back. So I will put some pressure along the sides of their vertebrae and their spine. I try to see, do they react to a certain location? Then if we find a location that seems uncomfortable, I'm going to do some more manipulation to find out how painful are we. And then to test for neck pain, what I do in an exam, and owners always think this is funny, but I'm going to take their neck and very carefully flex it from side to side, back and down. And I'm going to see what movement is uncomfortable for them. Obviously, if we see a patient who has any signs of paralysis or major neurologic changes, we have to be very careful about manipulating their back. But anytime I think, this dog might be painful, I'm trying to localize where do they hurt in their back or their neck. Then we start to do some neurologic testing. So there are different things we look for. Those signs and symptoms can help us also localize where a problem might be in the back. One thing you may see us do is testing for what we call conscious proprioception. So we'll take your dog's back legs usually and we'll flip them so that their paw is abnormally placed on the ground. And we want to see, do they feel that? Do they recognize that that's in the wrong place? And do they place it back the way it's supposed to go? And then we look at how fast do they do that. So in a normal neurologic dog, if we flip their paw over, they should put it right back pretty much instantly. And when we see a delay in that response, we call that a delayed conscious proprioception. And that can be an indication, especially in a dog we think may have IVDD, that we've got some neurologic impairment. There are other conditions that can cause those CPs to be abnormal. So that's just one of several neurologic tests we do to try to localize and analyze what might be going on. So in your GP veterinarian's office, there is a limitation to how much they can do diagnostically to tell you whether your dog has IVDD or not. Sometimes or often, if I see a dog who I suspect has back pain, if I see no neurologic deficits, everything neurologically looks normal, I'm going to be talking to owners about, hey, I suspect this might be IVDD. And I can't tell you that for sure unless I send you to a neurologist and they do some advanced imaging, so MRI or CT of their back and their spine, to determine, is there actual IVDD going on. What I do tell them is, though, I suspect that's what's going on. I often offer x-rays to rule out other causes of back pain. I think this is an important thing for pet parents to understand, is that your GP veterinarian cannot diagnose IVDD from an x-ray, and they cannot completely rule out IVDD with x-rays. That is a complete limitation to that diagnostic. I think there's misunderstanding. I think sometimes veterinarians take x-rays, and I have been taught by older veterinarians, oh, like you can see a narrowing between the vertebrae, so that's probably the IVDD. Is there some correlation between true IVDD and maybe some narrowing on an x-ray? Maybe, but we really cannot say yes or no from an x-ray. So when I take x-rays of a dog that I suspect to maybe have IVDD, what I'm doing is ruling out something else. So are there fractures in the vertebrae? Do we see severe arthritis somewhere in the vertebral column? Are there areas where we're seeing signs of severe arthritis that could be causing pain as well? Do we have any lytic lesions in the bones of the back? So are there areas where the bone does not seem as dense as it should be? That can be an indication of some more serious things like infection or cancer in the bones. So I explain that to owners. I say, I think your dog might have IVDD. We can take x-rays to make sure it's not something else, but the x-rays are not going to tell me that for sure. And so sometimes owners want to go ahead and do the x-rays, but a lot of times they don't, because x-rays are not the cheapest diagnostic we have. And that's okay, especially if we don't have neurologic deficits. And so often these dogs will be treated medically for their pain first. So if they're not neurologically abnormal, they have pain, we suspect they might have IVDD, we often will start, like I said, with medical management, especially if this is the first time they're having this back pain. Because again, remember, back pain does not always equal IVDD. It's a possibility. I make sure that I mention and explain it to them, and there's a reason for that, which I'll tell you in a minute. But it can also be other soft tissue and musculoskeletal issues surrounding the back. They can have a muscle strain. They can have some other kind of injury that makes their back hurt. That's not IVDD. So what I'm going to start with as a GP veterinarian is strict rest. So I tell them we need to keep your dog basically crate rested for at least 2 weeks. So no exercise, very controlled, on a leash or carried to go to the bathroom, and just rest. They need to be not doing much at all for 2 weeks. We don't want to put any pressure on the back. We want to give it complete rest and let any inflammation that's there calm down. So I'm going to rest them for at least 2 weeks. I'm going to put them on, depending on their degree of pain, we're going to put them on pain medication. I will also put them on anti-inflammatories. This is a debate amongst veterinarians. Do we put them on NSAIDs, non-steroidal anti-inflammatory meds, or do we put them on true steroids like prednisone? And every veterinarian has a little bit different opinion about if they use those and when. For me personally, and there's not really a right or wrong answer because even neurologists don't agree on this, but for me, if their pain is mild, we have no neurologic deficits, I will start with an NSAID sometimes. A lot of these dogs, though, I think do well on an actual steroid. So that's sort of a clinical judgment call. Like I said, one is not right or wrong necessarily, but something for inflammation is the point. So either an NSAID or a steroid, and then often we'll add other pain meds like gabapentin or pregabalin, sometimes even something stronger that includes an opioid. And we also sometimes will add muscle relaxants to these dogs. Methocarbamol is one that's used a lot, and that just helps to relax the muscle because often the muscles surrounding and supporting the back will get stiff and uncomfortable in reaction to that discomfort. And so that just helps everything relax. We keep them rested. We keep them on pain meds. We keep them on anti-inflammatories, and we monitor very closely. I talk to pet owners, dog owners about what to watch for that's a neurologic deficit, because as soon as we see any pain progress or we see any neurologic problems develop, we're going to want to do something more as soon as possible. So lower grade IVDD, where we don't have major neurologic deficits and we're mostly just painful, studies show that about 80% of those dogs are going to recover with just rest and medication. The problem with medically managed IVDD, if it's truly IVDD, is that a lot of those will recur. So there are different studies about this, but we think up to 30 to 40% of dogs who have back pain because of IVDD, even if it's managed medically, it's probably going to happen again. So this is an important thing to remember and think about, especially if you have a dog who is having multiple episodes of back pain from suspected IVDD. So when we have a dog that has neurologic deficits from suspected IVDD, for me, again, personally as a GP vet, I'm going to start talking to owners about when is it appropriate to refer them to a neurologist. I think anytime we have a neurologic deficit at all, it's completely fair to go to neurology. I think if we have recurrent episodes of just painful suspected IVDD, I think it's appropriate to go to neurology. Anytime an owner tells me they want to go to a neurologist, I will always send them. Once we start to see these neurologic deficits, there's a place for them to go to neurology, because once we see some neurodeficits, those can progress, and they can progress quickly. And when neurologic deficits in IVDD dogs is progressing, time is important. So one major thing we look at when we're evaluating neurologic function in these dogs is deep pain. So deep pain is the sensation of pain on a deeper level. And we get into the weeds of medicine that you don't have to understand. But we test these dogs if they have deficits to see if we put a lot of pressure somewhere on their body, usually use their toes to test, they should pull their leg back in response to that pain. So they can have superficial pain, superficial tissues, and then deep pain. And deep pain is like this red flag that if these dogs stop being able to have deep pain sensation, then their need for surgery is critical, because dogs who go to surgery to fix their back with IVDD, if they've already lost deep pain sensation, their odds of recovering and regaining function of their legs go down significantly. So if we look at the numbers, if we have a dog who has enough neurologic deficits and they are a good candidate for surgery, we will take them to surgery with neurology. A neurologist makes that decision. They're going to do one of a couple different types of surgery, one to relieve the pressure on the spinal cord and to make it so that that doesn't happen again in most cases. These are very complicated surgeries. This is back and spine surgery, right? So this is why we have boarded veterinary surgeons and neurologists. So depending on the location of the issue kind of determines which type of surgery they do. There's kind of two major ones we talk about: hemilaminectomy and ventral slot surgery. You don't need to remember that because your neurologist knows which one to do. But the outcome of back surgery for IVDD dogs can very much depend on what their clinical picture is like before they go to surgery. And deep pain that I was just telling you about is a big part of that. So if a dog goes to surgery for IVDD and they still have deep pain, they have about a 96% chance of regaining function of their legs after surgery. Those are really great odds. If they don't have deep pain at the time they go to surgery, those odds go down to about 48%, so less than half. And there are, different studies and numbers vary a bit, but it's significantly less in dogs who don't have deep pain at the time of surgery. So that's why it's really, really important that once we start to see any type of neurologic deficit, we're either going to neurology to get worked up, do some advanced imaging. They're going to want to do an MRI and or a CT to figure out, is it time to go to surgery? The sooner we can do that, if we can do that before they lose deep pain, we're going to have much more likelihood of success. And the cost of back surgery is, it's significant. In comparison to back surgery in humans, it's a steal. But it's significant. It's a significant cost depending on where you live and where that's done. The cost of back surgery for IVDD can range anywhere from $6,000 to $12,000, I would say. So that's a significant amount of money for most people. And so it's serious. It's a big decision to make. And it's just another reason why, if you have a chondrodystrophic dog, a dachshund, a Frenchie, a corgi, these dogs who are more prone to these issues, pet insurance can be so helpful in this situation, especially because this is a surgery that can, like I said, fix the dog. It costs a significant amount, but it can fix the dog. Recurrence when we have surgery can be as low as 7%. So, like I said, dogs that are medically managed often will have IVDD symptoms again. Dogs that have surgery, their chance of recurrence is much lower. So like 7 to 10%. And in general, medically treated dogs that we know have IVDD, their recurrence rate can range. And that has to do with a lot of factors. Why did it happen in the first place? What breed of dog is it? What actually is going on? What does the rest of their back and joints and everything look like? But anywhere from 15 to 66%, studies say, medically treated dogs will recur. Some of that also depends on where their issue was. So that's why I tell people, surgery is usually recommended for dogs with neurologic impairment, but it also can be recommended for dogs who have IVDD that happens over and over again that can be medically treated, but they're having these flare-ups, every couple of months, and it's really uncomfortable. There's also thought that these dogs with medically managed IVDD never really get to a great baseline of no pain. So we think that a lot of these dogs, or some of these dogs, probably deal with some chronic low-grade pain from their IVDD over time. And dogs are really good at compensating for pain at first. They can hide it, they can deal with it. And I think sometimes people are waiting for their dog to scream out all the time or act completely pitiful. But our dogs can be painful, and they can be showing us that they're painful, but those signs can be subtle. And so I think it's important to remember that if we're seeing those more severe flare-ups of pain every few months, it's very possible that they're hurting sort of all the time. And so those patients, I do chat with owners about, hey, maybe we should get a neurologist's opinion on if surgery, if one, is this IVDD for sure? Let's do the imaging. And then two, does a neurologist think this dog would benefit from going ahead and having surgery to keep it from happening again? There was actually a recent study this year was published that shows that, I wrote down some of these stats, 58% of IVDD dogs still had chronic issues after recovery. And I think I need to double check, but I'm pretty sure this was medically managed dogs. So they can still have spinal curvature, pain flare-ups, reduced stamina for things like exercise, and a lot of them need ongoing management. French bulldogs. Let's go back to the Frenchies. 52.7% had recurrence of IVDD, half within the first year. And then dachshunds up to 25% recurrence. And dachshunds can also have multiple disc issues. So all dogs can. I do see Frenchies and dachshunds are the two dog breeds in my experience I've seen have to have surgery multiple times. So it's just, again, this is a shameless plug for pet insurance for these dogs because they can need surgery more than once in their lifetime, and that's just because of the way that they are put together. So let's talk about, so that's kind of big picture IVDD, what it is, how we treat it, what it looks like. But I think it's important that we also talk about ways for you to prevent it. There are some things you can do as an owner of these chondrodystrophic dogs to try to prevent this from happening and to take care of them at home. So, for one, healthy weight is really, really important, right? So overweight dogs are much more likely to have these issues, just like all of our musculoskeletal issues. So if you have an overweight dachshund or an overweight Frenchie or an overweight corgi, the risk is higher. And so that's a very easy thing to fix. So maintaining healthy weight, maintaining a body condition score of 5 out of 9. Ask your vet, hey, what's my dog's body condition score this year when you're at your annual visit? And if it's higher than 5, ask them, ask them to help you. What's our ideal weight? How do we get down to that? You can add exercise. It's important to use exercise that's safe for them, that's not hard on their back. So not a lot of jumping, not a lot of twisting and turning. Swimming can be really good for these dogs, and walking is really, really great for them. Just getting them out, getting them moving more in a straight line walking is really, really good for these dogs. If you have a dog that has had IVDD or suspected or flare-ups, medically managed, or especially surgically managed, it can be very helpful to use ramps and stairs instead of having them jump onto surfaces like in a car or on a couch. Physical therapy can be very helpful for these dogs. There are more and more veterinarians and veterinary technicians getting certified and boarded in rehab and physical therapy. So there are services out there, veterinary clinics, veterinary hospitals, and businesses that do physical therapy. They do rehab. They have underwater treadmills. There are veterinarians that are doing acupuncture and all of these integrative therapies to help with these dogs. So you want to help strengthen their core muscles, make them stronger, have good muscle mass, and that can just help support the back as well. And then some dogs have IVDD and they have surgery after they've lost neurologic function. Maybe they've got some paralysis, they lose deep pain, they have surgery, and they don't regain function of their legs. And I just want to talk a minute about that because it does happen. And some of those dogs are great candidates to have wheelchairs and can live a pretty normal life. Obviously, that requires a lot of dedication from pet owners, and it's not the best scenario for everybody, but they can do really well, and especially smaller dogs and even big dogs. There are companies that make wheelchairs. They fit them for the dog, make sure they're comfortable, and so they can have great quality of life even if they're not ambulatory, like in their back legs. So just so you know, that's something else that can happen if they don't regain function, and there are options. And I have some patients that are that way, and a lot of them do really, really well. So there is ongoing research about IVDD right now. Are kind of two options to manage it that are established are medical care and rest and surgery. And there are veterinarians and scientists and researchers out there who want to figure out easier, less expensive, more effective ways to treat these dogs. And so I'm excited to see what's on the horizon, what's coming. It affects a lot of our patients, and I would love to see another option become available for us. So I hope this is helpful. IVDD can be really scary, especially if there are neurologic deficits. That would be very scary for me as a pet owner as well. And so it's important to intervene early. It's important to have open line of communication with your vet, realize what this might be. And once we've identified potentially IVDD in your dog, know what to look for, know how to manage them, and try to prevent it at home. And I would love to answer any questions that you have follow up about IVDD. So feel free to send me questions. We can do some story question answers. I'll post a question box on the Instagram when this goes live tomorrow. So I hope this is helpful. Let me know if you have questions about anything else. You can send me a DM at Dr. Molly Says. You can send us a DM at Dr. Molly Says Pod. Make sure you're following us. Make sure you're downloading episodes. Subscribe. We're also on YouTube. If you're listening to this, you can also watch it. And we post clips of each episode on our Instagram. So thanks for being here. And we will see you next week on the Dr. Molly Says podcast.